is good, Chrissy. Put your chin down towards your chest, as far down as you can. Inflection, he's full at 0. Lean your head back as far as you can for me. Extension, he's full at 180. Look at me. That's great. Now turn your chin over your shoulder. He's going 90 degrees left. Let's go to the right as far as you can. He's going 90 to the right. Now I'd like you to put your ear on your shoulder. Leave your shoulder down though. So let's just start again.
Okay.
Just relax and just let your head drop. That's good. And in lateral flexion, left, he's 40 degrees. Go to the right. And to the right, he's 40 degrees. And look at me. I'm going to compress a little. Any pain? No pain in compression. I'd like you to just nod your head up and down gently. I'm just going to look at the position of movement. Move up and down a little bit more. Great. Now put your chin all the way down again. That was occiput on atlas. Movement was good. This is atlas upon axis, and that movement's good too. And just look straight ahead at me. And now I'm going to reach and get a straight level just to see what your posture is. Anterior head posture. And your anterior head posture is about 9 centimeters. So it's slightly head forwards posture. And the last thing I'm going to do is just check the transverse process of atlas. Slide your jaw forwards. Does it hurt you on either side?
A little bit on the right.
Okay, so the transverse process of atlas is tender on the right and it's rotated to the left. Okay, Victor, I'm going to ask you now, if you would, to sit on this chair facing the television screen, and I want to press on some muscles of your head and neck, okay? You're comfortably seated?
Yes.
Now, what I'm going to do when I press is ask you if it bothers you. Now, I want to know if it's mild, moderate, or severely tender when I press, and also if it sends or radiates pain anywhere. Okay, and I'll tell you the muscle as I press on it. This is the infraspinatus. This is part of the rhomboid. Anything painful?
No.
And I'm trying to push with about 2 kilograms of force. We're going to the levator scapula. Nothing. And now we're pressing on the upper trapezius with a pincer motion, and now the supraspinatus. Nothing bothersome on that side. So we're moving over to the right side now. And these are the rhomboid areas. Levator scapula, upper trapezius, supraspinatus. Okay, I'm going to press on some paraspinal muscles. Nothing.
Maybe slight something here.
In your jaw? Which area?
It was lower. Right there.
Okay, right around the thoracic spine as it turns into the cervical spine. And is it still referring?
Yeah, I feel that way.
And it goes to your jaw?
Yeah, like right here.
Okay, so paraspinals, you can put mid-paraspinals going to the left jaw. I'm going to press on splenus capitis, semispinalis cervicis, and the other side, nothing. Okay, and I'm just going to press on some scalene muscles. Nothing too bothersome, huh?
No.
Very good. Okay, I'm going to ask you to sit on this chair now, and that way I can take a look at the anterior neck muscles. Doing all right?
Doing good.
We're going to give you a bib, and while we're at it, we're going to measure your neck. Sit your head forwards for me. We measure around the cricothyroid cartilage area, and he is 17 and a quarter. Okay, let's check a few more muscles. This is the sternocleidomastoid muscle. I'm just checking longus coli, that's when you swallow. This is part of the medial pterygoid, nothing too bad there. Okay, I want you to open your mouth just a little, and I'm going to press on the masseter muscle. This is the deep area, at the zygomatic arch, and at the angle of the mandible. Nothing bothersome?
No.
Okay, open your mouth a little. We like to put the muscle on a stretch when we test it, because that gives us a more accurate reading. So that was the temporalis, didn't bother you. We're on the masseter on the right side, open a little. and anterior temporalis. Okay, now I'm going to press on the joint itself. Does that hurt you?
No.
That's the lateral part of the TMJ, and now the dorsal, and still nothing painful. And on the right, not painful. Open for me, and close, and open, and close. Not painful at all. Okay, so I'm going to press on some internal muscles inside your mouth.
Okay.
Open just a little, not quite so much. Now I'm going to press on the area adjacent to the lateral pterygoid. Little sore, mild, moderate, or severe?
I'm going to say moderate.
Moderate. Okay, can you put that down, Chrissy? So this is the left lateral pterygoid. This is actually the temporalis tendon and the medial pterygoid area. That doesn't bother you. Let's go to the other side. Same thing, moderate. Okay, open. Temporalis tendon, medial pterygoid, nothing much there. Okay, let me take off this glove. We'll get another one. And let's move on now with neurologically checking you. So, let's start off with some simple stuff. And let's see if your eyes can track my flashlight.
Okay.
Very good. And now let me check pupil response to light. Just look at me. This is the ipsilateral and now the contralateral. Perfect. Okay. I'm going to check hearing. It's a tuning fork. Can you hear anything?
Yeah.
Both ears? As far as you can tell?
Yes.
Okay. Can you hear anything there?
Not really.
Okay, let's try it again. So we're touching on the mastoid process behind the ear. Tell me when the sound is gone.
It's starting to leave and it's gone.
Can you hear anything?
Yes.
Okay. Let's check the other side. Do you hear something?
Yes.
Tell me when it's gone.
It's gone.
Can you hear anything?
Yes.
This is a 128 hertz tuning fork. Okay, now I'm going to move on with some other things. I want to check and see you do some facial movements.
Okay.
I want you to smile big as you can. Now I want you to frown. Lift up your neck muscles here. Watch me. Perfect. Okay, relax. I want you to puff up your cheeks. Relax. Stick your tongue in your cheek. Push it in your cheek. In this cheek, please. Middle of your cheek. Good. Stick your tongue out as far as you can. Okay, put your tongue back. I want you to scrunch up your eyes really tight. I'm going to try and open them. Good, you have good strength that way. I want you to shrug your shoulders up in the air. Good. Now turn your head this way and back into my hand as hard as you can. Good. This way, back into my hand. Fantastic. Now I want you to squeeze my fingers really tight. Really tight. Go for it. Go for it. It's your chance to get even. Good job. Okay. So I'm looking at range of motion. You've got good strength and you have normal flexibility. You can't bring your thumb all the way back to your forearm. Also look at your hands to make sure there's no signs of any arthritic changes in the fingers. Okay, you can put your arm down. Now what I'm going to do is do some sensory checking, and there's two things I want to do. See if you can first discriminate pinprick and light touch on your hand. That's pinprick and that's light touch. Can you discriminate?
Yes.
Okay, close your eyes. Now, is that sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Very good. Now we're going to do the light touch specifically, and you can feel this on the back of your hand, a piece of paper. This is 10 micron mylar paper. Okay, close your eyes. Can you feel that on your face?
Yes.
I'm going to compare it to that side. Is it about the same?
It's a little bit less.
Okay, if this is 100 in touch, what number would you give that?
It's 95.
Okay, if this is 100, what would you give that?
Same. 100.
If this was 100, what would you give that?
100.
Very good. Okay, now let's take a look inside your mouth. And we're going to just check and make sure you have a normal response with your tongue. Say ah.
Ah.
Okay, very good. That's got a normal gag response. Okay, Chrissy, if you'd start reading out some stuff for me, we'll go through the rest of the database.
Okay, first one's dentition.
Okay, so he has a nice complement of teeth. I see wisdom teeth on the bottom, not on the top, and they're somewhat crowded. And you could do with a cleaning tooth cleaning. Okay. So normal.
Okay, nasal valve.
Okay, I want you to close your mouth. Breathe through your nose as much as you can. Great. And relax. Okay, that's good.
Septum.
Okay, so I'll look for the septum. I'm going to look straight down from behind. And he's pretty good. He deviates just the tiniest bit to the right. Okay.
Turbinates.
Turbinates were normal. They aren't large. And I'm looking inside the nose. And I'm just looking for any blockage. And he looks pretty clear. There's actually a little bit of extra turbinate on the left middle turbinate area. Okay.
Hard palate uvula.
Okay, open for me. Hard palate is high but not vaulted. Uvula is present and not enlarged, so normal.
Soft palate.
Soft palate is normal. Say R. Stick your tongue out for me. So his, I would say his Mallampati score is 3 and his Samson Young is 2. Tonsils are not visible. Did you have your tonsils out?
No.
No, okay, they're just small. So he has a tonsil size of 1. So from 0 to 4, he has a 1, okay?
Occlusion.
Okay, bite your teeth together.
With overjet.
Bite on your back teeth for me. Okay. So his occlusion is okay. We'll get into the crossbite stuff in a minute. And he has 3 millimeters of overjet, 1 millimeter of overbite.
Mucosa.
Mucosa is a little inflamed, and that's because he's overdue for his home care. His skin tone is good.
Neuro.
Neuro, we just did, is fine.
Lymph.
No lymph nodes palpable.
And tongue.
And tongue size, let's see, open for me, is, I'd say it's medium, and it's just above the occlusal plane.
Any scalloping.
Yes, there's slight scalloping of his tongue. Okay, let's go to the second sheet. How you doing? All right, okay. So now we're going to look at range of motion stuff. So the muscle palpation exam was fairly normal. There really wasn't anything significant there. So let's look at range of motion. I want you to open as much as you can without it hurting. So his inter-incisal distance is 51 millimeters. Bite your teeth together. His midline is 1 millimeter to the left. His mandibular midline is to the left. Slide your jaw as far as you can to the left. Keep going. Keep going. He goes to the left, 9 millimeters with tremor. Come to this side. He goes to the right. Ten millimeters. Keep going to the right. He's got a slight tremor that way. Okay.
Protrusive.
And protrusive. Bite together. Come as far forwards as you can. Further, further. 6 and close down. Let me give you the rest. Bite on the back teeth. 6 and 3. So he's got a total of 9 in protrusive. Okay, joint noises. Let's just see. Open for me. Close. Open. Close. Let me load the joint. Open. Close. Open. Close. And open. Close. And I'll listen with a stethoscope and see if there's anything specific, because I can hear next to nothing on you, Victor. You have the quietest joints. That's a good sign. Okay, and open, close, open, close, open, close, open, close, open, close, open. Joints are good, no noises. Let's go on to the next step.
George test.
Okay. So let's do a couple of things where we provoke snoring. Try and snore. Okay, and again. Good. And now I want you to bite your teeth together, slide them forwards, Try and snore. Okay, so it's a double positive. It does stop the snoring. Okay, and I'm going to do one other thing. I'm going to just spread your nares from underneath. I want you to try and snore now. And that's also a positive result. So both things seem to help reduce snoring. Next question.
Mandibular deviation on opening.
Okay. Bite your teeth together normally at the back. And I'd like you to open and close and open and close. And now just protrude your jaw forwards and back. Okay, there's no deviation on opening or on protrusion. Cervical spine we saw as normal. Muscle palpation exams normal. Let's go over to the second page. I don't think there's any other questions there, right? Okay. So now we're going to look at specifics on occlusion. Okay. Bite your teeth all the way together. He has a crossbite of tooth number 21 and 30. His anterior-posterior relationship is canine class 1, both sides. He has some lower crowding of his teeth. Let your jaw loose as you can. He has some muscle splinting, open. I'm looking for evidence of cheek biting. I don't really see that. While I'm at it, I'm looking also for any lesions, lumps or bumps. And I'm going to grab your tongue and look underneath your tongue too. So if you stick your tongue out for me. It's a bit of a slippery fish, so I'm going to grab it that way. Turn this way. And he's good that way, okay? Tongue is normal.
Missing teeth.
I don't see your upper third molars. Did you have anything taken out?
No.
So the chances are they're impacted. We would have to look and see on an x-ray.
Facets, bruxing or clenching.
Bite your teeth together. Slide sideways. And the other way. I see some chips, but they don't line up with any facets from grinding. The chips are on number 23 distal and number 28 mesial. Okay.
Periodontal pockets.
Okay. Open for me. So I'm just going to touch the gum now, Victor, in several areas, and I'm going to see if there's any heavy bleeding or any pockets greater than 4 millimeters. That would be an indicator to me that you need some gum evaluation and maybe treatment.
Restorative.
Okay, so there's no pockets over 3 millimeters. He's good that way. One, he has a little cavity occlusally on tooth number 32. Small occlusal also on number 31. Okay, let me look at the top. I do see the upper wisdom tooth poking through on the upper right side. And on the upper left side, I see them just starting to poke through. So you have all 4 wisdom teeth. Chances are you're going to need those guys out. You lucky guy, you. Okay, what else?
Frenum.
Okay, lift your tongue up for me. Up, up, up. Normal.
Cheek biting.
No evidence.
Tongue, small, medium, large.
Medium plus.
Scallops.
Yes, we already went through that bit.
Uvula.
Normal.
Um,
Malampati Samson Young we've done.
arch form. Average.
He is average.
Tori. Mandibular.
No.
Mandibulary. And tonsils we did.
Okay, all set?
That's it.
Okay, champ, one other thing we're going to do, and that's just test your bite. So I'm going to use that same very fine piece of paper, and we're going to see if you can hold your teeth together. Close down. Bite. open, close, open. So he's got contact 18, 19, close, open, close again, open, 20, close. On your back teeth, bite regular. All right, Victor, we've gone through the exam and I wanted to summarize all my findings and give you some recommendations. Now, first of all, we do not have the sleep study back yet from Sunset Lab, so I can't interpret what that is, and I can't read the pulmonologist's report. So I don't know how significant the sleep disordered breathing is, whether it's just snoring, primary snoring, or whether you have mild, moderate, or severe sleep apnea, whether there's any central apneas versus obstructive. And the differences are obstructive sleep apnea is when you can't breathe because something's blocking your airway up here, your upper airway, and it's like or you can't breathe at all, and you go at a certain period of time. That's sort of an obstructive apnea. Now, a central apnea is when you stop breathing and your brain is not telling your body to breathe. There's no effort from the chest. So if you had an obstruction, you're going to try. You're going to try and there's effort. If you have no effort, it means the brain is not telling your body, your diaphragm and your intercostal muscles to breathe. So we need to see that because that makes a difference as to whether an oral appliance is indicated. But let's say that the sleep study comes back that an oral appliance is an appropriate therapy. Well, I can understand that being a good choice for you because you're a single guy and you may be looking for a lifelong partner. I can see you saying there's just no way you would accept the CPAP like you had explained to me. So in that particular case, an oral appliance is a very good option. But let me give you every option so you can decide which is the right thing for you. First of all, there's surgical approaches. And when we look at surgical approaches, there's two types. There's soft tissue surgeries and hard tissue surgeries. The soft tissue surgeries are mainly done by ear, nose, and throat surgeons. And what they do is they will clear airway in your nose. Perhaps they need to correct a deviated septum or get rid of some excess tissues in the nose, polyps, or even some turbinates, which are bony, incidentally. And the other option would be that the ENT would do a surgery, a soft tissue surgery on the throat. They can take away the uvula, they can take away some of the tissues like tonsils and pharyngeal tissues. But in your case, I don't see much blockage that way. I don't think they would make an improvement, and the surgeries are not necessarily long-term successful for people. So soft tissue surgery in your particular case doesn't seem that reasonable, and certainly if you had trouble breathing through your nose, I would address the nasal blockage, but you don't seem to have that. Hard tissue surgeries are done on the jaws themselves. So a hard tissue surgery could be bringing your chin forwards or part of your chin forwards because your tongue's anchored to the inside of your chin. Another surgery could be to bring your whole jaw forwards, your lower jaw and your upper jaw. Now, that kind of a surgery, the mandibular advancement and maxillary advancement, is called an MMA surgery, is quite a successful approach and could be considered a curative approach. Somebody at your young age, you might consider that because you've got so many years of treatment the other way. And I mean by that is that if you decided that surgery was not the right choice for you at this point, you could do oral appliance therapy or CPAP. If CPAP is not doable because it's just going to, let's say, keep you a single guy too long, then we're looking at the oral appliance. Now, you had one before and it worked well for you. But for me to make you another oral appliance, I'm going to need to get a prescription from your physician. Legally, I'm required to have a prescription, and your physician needs to know what's going on. So I'm going to show you some different oral appliances so you can see how they work. But typically, they are two types. One is a tongue guidance or positioner or retainer, and another would be a jaw repositioner called a mandibular, that's your jaw, anteriorization forwards device. So a MAD device or a mandibular repositioning device. And there's different designs on them. In fact, there's many different mouthpieces, oral appliances out there now to address sleep disordered breathing. In fact, one of the appliances also does something to raise and spread your nose, and I noticed when we were testing you, that seemed to help you as well to breathe better. So we're going to look at some of those devices, and I think an oral appliance is a good idea. However, every treatment has some downside or side effects. So this is an informed consent form that I'd like you to read through and be able to ask me questions, and I will highlight any issues when we go through the next sort of stage of treatment for you, so that you know what the risks are and you can weigh them into the consideration of which treatment you prefer. Now, these were the findings that I had on the exam. First of all, I looked at the range of motion of your head and neck, and it was fine. I looked at you neurologically and screened you that way, and you were fine that way. When I pressed on the muscles of your head and neck, great. No tenderness of significance. One area that was a mildly tender. Not really dramatic, and that was in your upper back, and a couple of spots inside your mouth that were moderately tender, mild to moderately tender. So from that perspective, and from the checking out of your jaw joint, which was entirely normal, I think that you're a good candidate for oral appliance therapy. The issues that we would have that restrict us from moving along with that are, first of all, we do need the prescription from your physician. We need to review your sleep study, but also you need a little dental work done. Your wisdom teeth should be addressed, although you don't absolutely have to have them taken out for us to do oral appliance therapy. Long term, there's not enough room for them. You have a couple of cavities, those need to be dealt with, and certainly if you had dental x-rays, they might find a few more cavities, and those would need to be addressed. And then there's also the issue of the gum disease. You've got some inflammation of your gums, and it seems like it's been a while since they've been cleaned. So those things have to be addressed first. But once those things are addressed, if we get all the other things lined up, we can move along and get you oral appliance therapy started. So in that light, let me show you a few different appliances, and then we can talk about what the pros and cons would be for you choosing one or more of these different devices. So I have here a little box of a few different ones, and I'm going to highlight just a few different ones so you can look at them and what the pros and cons are of the different appliances. Okay. And I have a few more appliances too. There's one that is not out on the table here, which is called a tap appliance, and it has several different models. And I'm going to show you a few more appliances at another time, but I don't want to overwhelm you. So let me just show you a few types. First of all, this is one type, which is called a tongue retaining device. The tongue goes into this bulb. You squeeze the air out, you put your tongue in, and that holds your tongue. Now, these are not as reliable as the other appliances, and I'm not recommending it for you. Now, if you had no teeth or you had some problem with your jaw joint, we could consider it. There are other types of devices that also will push on the tongue to guide it forwards, and those things may or may not be useful for somebody that has jaw dysfunction and cannot tolerate a repositioning device. But if we were to look at the research, we would find that the repositioning devices work the best, and they reposition the jaw by anchoring the top and the bottom together, and by anchoring them together they can use some sort of mechanism to have the upper jaw guide the lower jaw forwards. This particular mechanism is sort of a modified Herbst. You can see it's got a cylinder and piston, and you can see little washers that can be added to bring the jaw further and further forwards. Now, I like these appliances because they allow for movement, and it's nice if you have movement. That way your jaw doesn't feel locked in, and if you were trying to move your jaw, you don't necessarily get sore teeth. One of the downsides of this kind of appliance is if you have sensitive cheeks, these bumps can be irritable. Now, for people that perhaps do not have such strong teeth, we sometimes use something that's a little bit more flimsy, and this is an EMA appliance, and this one can fit on the top and the bottom. This one tends to have less ability to adjust. Let's say you broke a tooth and you needed to fix it. There isn't much play that I have in these appliances as opposed to these, where I can repair or change them a lot easier. But it does the same thing when you use different size elastic bands, and they're a little bit more forgiving because they're rubbery versus metal. Now, if you were to use an appliance that was a one piece, these things are made, and these can be fit and can work as well. The downside to them is they do not allow for the same kind of movement. In other words, you can position the two pieces in different positions further forwards and back, but unfortunately, once they're connected, you can't move. You're stuck. And so for somebody that likes to move their teeth at night, it's not so comfortable. The other thing is, any of these appliances can have a soft inside. If you have very sensitive teeth or you feel like your teeth are fragile, you could have this soft liner as opposed to a hard liner. The downside to a soft liner doesn't last as long. The upside, it's spongy, cushy, it's a little bit more comfortable. In the morning, we sometimes will have you wear an appliance that allows you to bite your teeth together, because all these appliances tend to bring your jaw forwards and hold them forwards for that period of time that you're asleep. It might be 4 to 6 hours. So for other people, it could be 8 hours. You sleep less than most people. So in the morning, if your jaw feels like you can't bring your teeth together, yes, you can certainly try to wait it out and try to push your jaw back or chew some gum. But sometimes I'll give you a morning positioner, which gives you little bumps that you can bite on, and that helps to bite down and helps to bring the jaw back into position. Most of these appliances I've showed you so far are connected. A more recent appliance is one here, which is a repositioning forward appliance called a Somnomed, and there are other types just like it. And this one does not have necessarily a connector from the top and the bottom, and what happens is these particular spikes or fins tend to guide your jaw forwards. So what happens is the fins fit on the lower jaw and this piece fits on the upper, and as you close your mouth, the fins guide the jaw forwards. And of course you can see little adjusting screws on both sides, and that brings forwards this block, and this block pushes the fin further forward. So that's another appliance if you didn't want to be able to keep your mouth closed. I think it's better if your mouth is closed. If your mouth is closed, you tend to breathe less through your mouth, and I think that tends to help you with heating or humidifying the air as you breathe in. So these are repositioning kind of appliances, and these are some, and next time I'll show you a few more. But this is the design, and then we have to go through what the pros and cons would be. Now at this point, our steps are going to be for you to be able to get us the sleep study. We'll try to do that. For us to be able to send the report to your physician and also ask for an approval for oral appliance therapy. You'll need to sign this informed consent, and you'll also have to give us an affidavit as to why you will not use CPAP. Once those things are all completed, we can move on with the next step. We'll need to find out from your medical insurance how much is covered and how much your copayment will be, and my front staff will help you do that. However, before you move on to the next step of having oral appliance therapy made, I want you also to check in with your dentist and get that dental treatment done. Okay, so that takes care of us for today, and we'll look forward to seeing you, and I'm going to pass you off now to my front staff who will take care of you. Thank you so much.